Hello, everyone. I have a wonderful patient of mine from California, and she is 53. She is 2 days out, 48 hours from her surgery. Now, let me ask you a few questions. How's your pain?
It's a 1, if that. I don't really have pain right now in this moment.
Yeah, and this is you had 325 cc implants below the muscle, directly on top of the rib. And so, relatively speaking, it was involved surgery below the muscle. And you're just 2 days out, you're just taking the Tylenol as needed once here and there. Now, how was your anesthesia experience?
It was amazing. I literally laid on the table and they said, go ahead and lay your head down and we're going to give you a little bit of a drip, and I fell asleep. And then I woke up and it was amazing. It was a light. I didn't feel anything. I didn't remember anything, and it was peaceful.
Yes, it's not very happy. Now, you came from California by yourself. Now, you had Kim help you, right?
No,
Or Kathy. No, it was Kathy. So Kathy helped you. So we have Kim and Kathy. And so Kathy is wonderful, and so is Kim. Both of them are wonderful. They help recover my patients, especially when patients come from far away. Their family members are taking care of kids, or if they're busy with their lives. You certainly can, for the first 24 hours, use their independent services so that you can get the recovery. How is Kathy?
She's amazing. She's loving, she's caring, she's attentive, gentle. She's incredible. I just love her.
And I say every patient should have a Kim or a Kathy, so it'll help them with their recovery.
100%.
And because this really, they're on top of things. They help you. They help basically condition you post-operatively. Now, what made you come all the way from California to me? Why did you want to get this surgery?
Do you mind if I talk about Kathleen one more
Yeah,
minute?
please.
Even if you have a spouse that comes with you, I still recommend having Kim or Kathleen with you, because they just know how to care for you excellently.
Yes, and I will tell you, I had a nice lady, also, if I do remember correctly, from California, and she came with her teenage 18-year-old adult son. Nice, very wonderful. But I will tell you, that the young gentleman, just like when I was 18, the last thing on my mind was to care for someone, and I totally understand. But this is where, you want to be on top of things, help direct, and it truly helps with your post-operative recovery. Yes, please. So how did you find me? Like, why did you come to me?
I started searching on social media because I had 2 previous surgeries that were, one was really bad, so I had it corrected for breast augmentation, and then I was having a lot of symptoms, as all of you know already what those symptoms are, BII, and it was just horrible, very, very painful, very a lot of struggle.
What were those symptoms exactly, if you can highlight those?
Oh my gosh, there's like 100 or more of them. Brain fog was really bad. Sleep apnea, I couldn't sleep ever. I just had a hard time sleeping. I can even tell that my teeth changed. I know that sounds probably funny, but I can tell that things have shifted with that. My eyesight and my body inflammation, a lot of things. I'm so sorry, I can't remember everything right now.
Sure, I understand.
Yeah.
Now, I will tell you I'm just going to go ahead and read these off. This is the questionnaire. Remember, there is no exact diagnosis, but you had the many signs symptoms that include the fatigue, brain fog, muscle aches, pain, weakness, joint pain, soreness, hair loss, dry skin, dry eyes. You had looking at your symptoms, the autoimmune type issues, GI issues, dryness of the eyes. You had the throat trickle, and so all these other symptoms that you had mentioned, almost more than half of them on that questionnaire. Now, this is what we want to know, is how your perioperative experience was. Sometimes it's too early at this phase, 48 hours out, to even gauge and see, what recovery are we looking at. We want to continue to hear from you 1 month, 3 months, 6 months. some patients, a year out to see the difference before and after. Now, why did you end up choosing me?
I did a lot of research I did my due diligence, whereas before when I was getting them in, I didn't do my research, so I learned. And you are highly rated. The way you do things, you're taking out the whole capsule versus just the implant was important to me. And the other main thing is that that's all you do. You are specializing in taking the whole capsule out. You don't put implants in, and that was a priority for me, because that tells me that you not only have love, care, and understanding of what's going on with the body for women, but also that you know exactly what you're doing. This is all you do. You specialize in it, and so that was important to me.
Sure, no, this is important. Any surgeon who's augmenting truly then does not give credit to breast implant, unless why would anyone want to harm? Now, this is where if 1,000 ladies got implants, correct, eventually all 1,000 of them eventually would need to get them removed, replaced, or meaning they're not lifetime devices as clearly highlighted by the FDA and by the manufacturers themselves. And this is the point where, do no harm, especially the saline implants. Back in the day when you got these, the silicone implants were banned, and the saline implants caused the same hurt as the silicone implants, and this is where the saline implants should have been taken off the market as well. They should have been banned as well back in 1992, if you ask me, because the symptoms are more or less the same. Anything you want to say to anyone who is contemplating thinking about explant surgery?
Yes, I say, go within your soul and listen to yourself, because the people around you don't understand what you're going through. It's really internal. It's in your mind, your body, and your soul. You need to stay connected to that in your heart, and know that no matter what your circumstances are, keep working at it. Whether if you can't afford it, or you're struggling because you have children, you can't leave them, you really need to find it in yourself to care for yourself. It was very difficult for me to get here. A lot of circumstances were trying to hold me back. So stay focused, stay on the path, and make sure you do that, because once you do that, then you can care for everybody else after. So love yourself.
No, thank you very much. That's very important and deep. That's so true. Thank you very much. Appreciate it. Thanks for your feedback. And we will continue to hear from you in the next several months as to what your recovery is. Thank you.